We'll post this to our AHI webpage as soon as we possibly can. And then if there is a need for an additional training, we will do that as well. So without further ado, welcome to the Netsmart Gaps in Care training. I think most of you know me. I'm Taylor Dawson. I'm the Compliance and Quality Performance Manager for the Health Home. I also have Jessica Robertson and Travis Bethel here, the Assistant Director and Director of the Health Home. So as we go along, you guys know we're pretty informal. Please feel free to, pop your hand up or pop a question in the chat if you have anything. This should be, like I said, a fairly quick training. We did go over a little bit of this on office hours. This is just really going to be a little bit of a deeper dive on where to find the gaps, how to close them out, the various statuses and things of that nature. So this is obviously going to be kind of a workflow change for you guys. In the past, I've just sent out all gaps in care to supervisors in an Excel format that we received directly from the MCO. Now they're going to be uploaded in Netsmart, and it's going to allow us to better track the gaps in care and also provide feedback to the MCO. So we hope that this is a pretty easy process for you guys and will be helpful in monitoring the gaps and ensuring that our members get the best care that they can. So for our agenda today, did my screen change? Just making sure.
Yes.
Yes.
Okay.
Yep.
Thank you. Okay, so we'll touch on where to find the gaps, how and when to update your Netsmart gaps in care, the various statuses for the gaps and when to use those statuses, the upload cadence for the gaps, tracking them in DataDen, and auditing. So we went over this briefly on office hours, but where to find your gaps in care in Netsmart. So you guys have probably noticed they did send an email out to the distribution list earlier this week that we have uploaded some gaps in care for the entire network into Netsmart as of Monday. So you guys may have noticed that you have them in Netsmart now. So if you are on your Netsmart homepage, you can toggle over to this middle tab here called Work Lists. And once you click that, you will have a report titled All Gaps in Care or Gaps in Care Care Managers or Gaps in Care Supervisors. Within that, you'll be able to see all the gaps that either are attributed to your agency if you're a supervisor or attributed to you as a care manager if you have care manager permissions in Netsmart. So you will be able to see all your open and in progress gaps for your members. That way you can track any that may need follow-up. We'll jump into the other statuses a little later in the training, but just for ease of use and being able to track the members that still need some sort of follow-up on a gap, this work list is just going to display those that are open or in progress for you guys to be able to track those. So on this particular screenshot, there's no SIN number here because it's in our testing environment, but to access the gap in care, you'll just be able to click on that SIN number and it's going to take you right to that member's demographic page. Again, supervisors will see gaps in care for everybody that's attributed to your agency that has a gap. Care managers will see the gaps for the members in which they are assigned. So once you click that SIN number, it's going to take you right over to the members demographic page. You guys have probably noticed that you have a little gaps in care tab on the left-hand side now. It's been there for a few months as we've been testing this process. Now, when you click on it, if the member has a gap, it'll show you any of the active gaps that that member has. So this is what it will look like when you click on that gaps in care. I just want to touch on that trigger is the word that Netsmart uses. We're unable to change that verbiage in there. So when you see trigger date, new trigger, it's basically just gap in care. So just keep that in mind. When you're working through Netsmart, that is basically how it was built. We have no ability to change that, but that does mean gap in care. So when you toggle to the gap in care page for each individual member, you'll be able to see any of the gaps that have been uploaded for them. You'll be able to see any closed gaps or any of those other statuses too. That I mentioned previously that are not available on your work list. You'll be able to see those here. They just be marked closed or whatever the gap is. So when you navigate here, you'll be able to see the date. This trigger date will be whatever date it was uploaded into Netsmart. You'll be able to see under trigger, that'll show the actual name of the gap. or the measure, the status. All gaps that are uploaded into Netsmart by the health home will come in an open status. And then it'll be the responsibility of the care manager to update that as needed. And then whichever MCO the gap in care came from. So let me just toggle back quickly. Oops. To view the individual gap, you'll click, just like you're clicking on a document in attachments or whatnot, you'll click this view button, and that'll take you into the actual gap in care. Once you're actually in the gap in care, then you'll be able to edit it, if applicable. So again, you'll see the gap, the MCO, the date of opening, and the MCO, that all auto-populates when we upload it into the system. So as you begin to work with the member on the gaps in care, you can update the individual gap in care by updating the status and adding comments. So there's 4 statuses that are available to assign to your gap in care. So again, when we upload the gap in the system, it's automatically going to come in as an open gap. As the care manager starts to work with the member, maybe they need a well child visit, and the care manager, schedules the appointment for the member, but say the appointment isn't for, another month or another 2 months. The care manager can then go in and mark the gap as in progress. That way it's still going to show up on that work list for you guys to be able to track that there's still some follow-up required for that gap. But it's no longer sitting in that stagnant open status that kind of expresses to us that nothing's been done with it so far. So you can mark it as in progress as you start to work with the member, or maybe the gap is closed, but you want to make sure you have that paperwork. So you reached out to the provider to gather the documentation to upload into the chart. That is kind of a status to make it so we're aware that that is being worked on, and to keep it active on your work list. That way you guys know it requires a little bit of additional follow-up. Complete obviously is pretty self-explanatory. If the gap has been closed, you guys can mark that as complete, and there is a free text box, which you guys will see on the next slide, where you guys can make any comments about the gap, about the closure, about it being in progress. That way you can keep tabs on it, and we can keep tabs on it as well. Go ahead, Deb. You can unmute yourself.
So I actually have Netsmart brought up right now, right? And I was looking at it because that's how I learn better. And I'm not seeing that gap list on a folk that someone I do have a gap. So how do we get to that if it's not there? So, like if the gap list is not over on the left-hand side when you get in their chart?
I have a feeling you guys have particular permissions at Hudson Headwaters. So I'm thinking maybe it wasn't turned on for your
okay.
So let me just double check after the call, and I will shoot you an email, but I'm assuming that's what it is. You guys have.
Okay. I was just looking, and someone else sent me, a message. Hey, can you see it? I'm like, yeah, no, I can't see it either. Yeah. So I just wanted to make sure there wasn't like another step. It should be right there on that left side, right? Yeah. Okay. Yeah. Perfect. Yeah. Thank you.
I'm Taylor, sure that's what it is. Yeah.
There's a couple people in the chat that are saying the same thing. Do you want me to take their names down and you can look into it after?
Yes, please.
Okay.
Just FYI, everybody, I am in Netsmart looking right now, so I will check all of the user roles and permissions. So hopefully I'll have an update shortly.
Thank you.
And everyone's saying they can't see it's from Hudson Headwaters, so
okay.
You don't have to worry about taking names.
That makes perfect sense.
Thank you, ladies. Sorry.
Thank you, guys. So again, the complete status, you'll mark that once the gap has actually been completed. And then member refusal. Obviously, we know this population that we work with isn't always going to want to follow up with the gap in care. It is the care manager's responsibility to make them aware of the gap, try to get them to close that gap. But there's always going to be those instances in which they're just flat out refusing. So for those instances, we want you guys to mark member refusal and just write in a note about your efforts to close the gap with the member. Obviously, when, as we go through and audit this, we don't want to see that a care manager is marking, every single one of their members member refusal, and they don't have any notes in there about them trying to connect the member to a provider for that gap. But when it is necessary, we know that it happens. That is a good status to use for that gap in care, that the member just flat out does not want to address it. So this is just a screen grab of what it is going to look like in the system. So again, we're using that trigger name here you see. So under trigger, that's going to be the measure. The trigger date and the status date is going to be the date that it is uploaded into Netsmart. If you guys have a follow-up date, say you do schedule an appointment for that member to get that gap closed and it's in the near future, you can go ahead and put the follow-up date in there. Under status, that's where you will change it to one of the four: complete, in progress, member refusal, or open. The scale over to the side doesn't have any drop down, so you don't have to put anything in there. And then, of course, there is this free text box here at the bottom where you can write in any notes related to the closure of that gap. So please update the gap in care to the appropriate status as you work with the member, and add comments in the free text box as applicable. Like I said before, we are going to be looking at these to make sure that there is movement on gaps in care. So it's very important that the care manager is following up and updating them to the appropriate status. We will also be sending this data back to the MCO. So we have built a report in DataDen to extract this data and send it back to the managed care companies. I know many of you have probably experienced where I have sent you the gap in care list and you have emailed me back and said, this gap is already closed. This is the perfect way for you guys to track that in the system. Mark the gap as closed, right in the free text box. Gap was closed on such and such date. Documentation has been uploaded into the chart, and then we can provide that feedback back to the MCO and hope to clean up these lists in the future, because I know that this is something that has been, it has come up a lot when I send out the gaps in care. Things happen, providers bill incorrectly and the gap doesn't get closed, but it is in fact closed. So we want to make sure that we are providing that information as best we can to the MCOs. So that's where you guys come in and making sure that those statuses for the gaps are uploaded and the notes are in there as well. That way we can provide that feedback to the MCOs. So cadence for the gaps in care uploads. Unfortunately, there's not going to be a set cadence just because of the way that we receive data from the MCOs. So some MCOs send us the gaps on a monthly basis, some send them on a quarterly basis, and they never come in at the same time every month, just kind of whenever they get them done. So they will be imported, of course, directly into Netsmart. We have to go in and kind of do some manual manipulation to get them in a friendly uploaded format. And then as soon as we get them and get that, situated, they will be uploaded for you guys.
Yeah.
Like I spoke about. Oh, did somebody have a question?
Concerns regarding Melinda.
There is a question in the chat. Do you want me to read it?
Sure.
It's from Tara. Can we complete the gap with a future appointment scheduled, or should we wait until they've had the appointment?
I'll leave that to your professional judgment. I think it would be better to put it in progress and just put the date in there that you have the appointment scheduled for and then go back and close it. But I'll leave that to your professional judgment, Tara.
And then
Okay.
Misty asked, will the MCO also get the comments?
Yes, they will get the comments as well. So because this is a change of workflow for everybody, I will be sending out, you guys probably got my email earlier in the week.
Okay, what was the place called again?
When we do upload the gaps in care into the system, that way you guys know that they have been recently added. But again, you will be able to access those through the work list, and then you will also be able to see them in DataDen as well. So speaking of DataDen, again, you guys will be able to track these through the system. So if you haven't taken a look at it yet, there is a new report that was published earlier in the week. It's titled Aptly Gaps in Care. So you can toggle to that from your navigation page, and you'll be able to see, again, the supervisor level will see everybody that has a gap from your agency, and the care manager level will be able to see just those that they are the assigned primary care manager on the case. So unlike the work list, the report in DataDen will show you gaps in all statuses. So the intention of the work list is to kind of, in Netsmart, is to make you guys aware of what's open and in progress and needs further follow-up. Whereas this DataDen report will allow you to see those in addition to any that have also been closed or the member has refused. And then if you're looking to, again, toggle between any that are maybe open or in progress, you can very easily filter on the status of the gap in the data den report. You can also filter by MCO or specific measure. And then lastly, I just wanted to touch very briefly on auditing. So we will be incorporating the gaps in care into our comprehensive chart audits for 2025, and it will be the care manager's responsibility for updating those gaps in care statuses for their members in Netsmart. We will be updating the comprehensive chart audit tool, and we will provide that to you guys once we have updated that. But that we will be looking at this when we audit to make sure that people are following up with the gaps. We have not historically had a good way to do that. So this is kind of enabling us to be able to take a little bit of a closer look at those gaps in care, because it is a very big and important part of our redesignation process as a health home.
Hey, Taylor.
Yes.
Mary asked, can you please clarify what documentation should be uploaded to support gaps in care?
Just proof that the gap has been closed. So it's going to vary depending on, what the gap is. But any documentation from the provider that they've had that done will suffice. Okay, I told you guys it would be short and sweet, so I will open the floor up to any additional questions.
Tanya has a question.
Hi, Tanya.
Hi. So I've been following it as you've been speaking, and it does seem pretty straightforward, which makes me happy because not everything in Netsmart is. But my only question is, if we go in and so like I just had one where unfortunately the member is refusing the gap in care. Yep. I put the comment in with notifying last dates, notifying the collateral contacts that I've made both with providers and pharmacies. Do you want us to put in a contact note, or is our comment enough?
Your comment is enough. It's going to make it way easier for us to keep track of it if it's, directly tied to that specific gap. Great question.
Thank you.
Amy asked, could proof of completion of gap in care be a conversation with client that they attended appointment and documented in a note?
Jessica.
Yeah, so sorry, I was just typing back to Mary. So every gap in every population is going to be a little bit different. So if you're working, let's say with the children's population and where you have an open gap for a wellness visit, what we really look for and the state looks for is to actually have a copy of their most recent physical with their immunization. So in that instance, you're going to be looking for something to be uploaded. If you're working with the adult population and they're looking for testing and there's an open test, you talk to your member about it, you get it scheduled, you help them get it scheduled, they say that they went, you can go ahead and close the gap and then put the details of that in there. You're not going to be able to get most likely documentation unless you go into HCSCNY and you find that the testing happened, and then you got to rely on the billing to go through to get all that information. So in that instance, if you feel comfortable go ahead and closing it, you absolutely can do that, and then just make sure the documentation is there. What we are going to do is, because we're having this all reported in Netsmart, we can extract all of this documentation out of Netsmart. So if you feel comfortable closing that gap, not having supporting documentation uploaded, because not everything is going to have something to upload, we will report back to the MCO that such and such client went, they had this testing done, they went on this date per the health home care manager, and that MCO should see that gap closed. As we all know, we're all dependent on ensuring that these things are coded correctly when someone goes to see a provider. So in that instance, if it never shows and the MCO reports back to us, hey, they never went, well, then we have to look at did the provider bill correctly? Did they code it correctly? And then potentially we're looking at education. So as long as you feel comfortable on your part, updating that gap in care and closing it because you feel that you have done everything that you could do to get that taken care of, they reported to you that you went, that is sufficient, and we will just take those comments and report that back to the MCO. And then I do have one person from Hudson Headwaters saying that it did not work what I did. I will,
Oh,
oh,
it worked.
never mind. She got it. Okay.
Awesome.
I hope that answers the question about as far as closing something out.
And Mary, your question about anticipating issues with the timely documentation, as long as we see some movement there, I would mark that, if you're working on getting that documentation, mark it as in progress and just write in a little note there about the care manager's efforts to, acquire that documentation, and that will suffice until the gap is closed.
And Faith wrote a question in. I got to the training lab. I'm not seeing anything when I click on gaps in care for individual clients. Is nothing there? Is it not loaded yet? So not every single client is not going to have an open gap in care. So that's awesome, Faith, because that means that all of your clients have all their needed testing and appointments. And they don't have any open gaps in care because they've had everything done. So yes, not everybody is going to have something that populates in that section. It's only going to be for required testing or required appointments that need to occur. So if it's blank, that means one of two things. One, something's not working, which shouldn't be the case, or two, you've done exactly what you needed to do and everybody has everything that they need.
Great questions, everybody.
Hello, I see that one of my patients has 6 different triggers, one being controlling blood pressure, and I know she is taking her medication and makes all of her appointments. That is one question.
Okay, Lisa, so the one that Hannah just read from Lisa, if that is the case and everything is being followed up on, just note that. You can go ahead and close it. And then what we'll do is we'll report it back to the MCO if they have managed care and let them know that we are not sure why this is remaining open because that should not be the case.
Right. Okay.
Yeah, anything where you guys are seeing that, make sure you're writing it in that free text comment box. That way, when we export things out of the system, we can provide that feedback to the MCO.
We have a question that says, what about clients we know have open gaps, but it's not showing? Example, clients who need mammograms or flu shots. So we are reliant on the managed care companies to send us their forms for who they would like to focus on for open gaps. So Kylie, it may be that the particular member that you are working with, it is not a gap that we receive from their MCO, but you can email us who that person is and who the MCO is, and then we can cross-reference the file that we get from the MCO just to make sure we're not missing anything.
Absolutely. There's some of the MCOs provide a much more robust list than others. So some of them we only receive, not even a handful of different measures for, whereas others will receive, upwards of like 30 different measures. So it might, like Jessica said, just not be that the MCO is reporting that measure to us.
We have a question from Jennifer at Hudson Headwaters. If the annual visit is the gap, do we just have this scheduled? Yep. So if you have an annual wellness visit that you need, that the open gap is for, you can go ahead and get that scheduled. And then if you feel comfortable that that member is going to show to that visit, you can go ahead and close that out.
I'm getting a question. It's kind of similar to what's in the chat from my staff. Some people aren't sure what the gaps mean or how to close them. I know that in the past, the MCOs have sent out a description of what the gaps mean. So I'm not sure if you guys have that saved and we could send it out to the network.
Yes. I am not sure I have it for all of the MCOs, but I at least have most of them. I can compile that documentation and send that out to the network, and that pretty explicitly lays out each individual gap that the MCO reports on and how to satisfy that gap.
I think that would be really helpful, Taylor. Thank you.
Yeah, so with, like Taylor said, some MCOs, when we used to do the Excel file that Taylor used to send out on one of the sheets in that workbook, or directly in that spreadsheet, it would tell you what would meet the requirement on how to satisfy that gap and close it. But we can absolutely put together a document with all of that information since they're automatically being uploaded and not distributed via that Excel sheet.
Thank you.
Andrea, I see your question about a preset category in the uploads tab. I honestly hadn't even thought about that, but that is a great question. So I will take that back and talk through that with the admin team and let you guys know if that's something we decide to move forward with. But sounds like a really great suggestion. So thank you. Go ahead, Andrea.
So how would you want the uploads to be labeled? I know that for data purposes, the labels do matter. So if a client were to go to a PCP appointment, normally we would just label it, you know, primary care appointment documentation. But if it's pertaining to a gap in care, do you want us to specifically label it gap in care if there's not going to be a preset selection? I just want to make sure we label the documentation appropriately because I know it matters.
Yes. In the meantime, while we have that discussion offline, just label it gap in care documentation. That will be perfect.
Thank you.
Thank you so much. Okay, great questions, everybody. Do we have any other questions before we hop off? All right. Well, thank you everybody so much for coming today. Thank you for your great questions. Again, this will be was recorded, so we will. Tom asked, will the downloaded documentation be forwarded to the MCO? If the MCO should be on the 5055, if the MCO requests that documentation, we will send it over to them. So we will post this training on the website for everybody to have access to. We will talk internally about a category for uploaded documentation, and I will compile a guide for everybody based on the different measures from the MCOs on how to satisfy those gaps. And I will get them out to everybody as soon as possible. We'll give everybody some time back. Thank you again for coming, and I hope everybody has a great rest of your day. Bye, everybody.
Thank you.
Thank you.